Okay, this short video is to satisfy the criteria for assignment 3 for the HLST 320 course. We will be focusing on case study number 3, which involves Jane, the preceptor student who suspects that she has made a medication error. Because she is frightened and tearful, as her preceptor, it is my responsibility to ensure that I support Jane through her learning to minimize risk of error as it relates to medication administration. Okay, Jane, so by the end of this teaching session, you will be able to demonstrate safe medication administration by safely assembling the patient's medications using the 7 rights of medication delivery and the 3-check rule. After that, we will prepare a medication together utilizing those 7 rights and 3 checks, and then I'll go with you to the patient's bedside and we will administer it together. So as mandated by CARNA, these are the 7 rights of medication administration that will guide your practice. So let's review these together. The first one, the right medication. So this involves you looking at the MAR and the label of the medication. Is the name spelled correctly? Are they identical? Is it the right medication that you intend to give the patient that day, right now? The second one is the right dose. So this you're looking at the prescribed medication order on the MAR. Does it match with what you have on hand? If it doesn't, you're going to do an appropriate calculation to give you the prescribed amount, the right dose that is ordered. The right client, you're going to be looking at the name on your MAR and you're going to be comparing it to the name on your medication. Again, you're looking at that it's spelled correctly, it is the right person. You will do this again at the patient's bedside as your 3rd check. You're going to be comparing the patient's name tag with the MAR that you're going to be bringing with you. The 4th one, right route, again is mandated and prescribed by the doctor's order. So we're going to be looking at, is it an oral route? If it is, are we giving a tablet? So does that match? Then I have right time and frequency. So for the right time, again, it's prescribed by the doctor on the MAR. So I'm going to look at my clock or watch and see that it is the right time or it's within a half an hour window before or after of the prescribed time, and that's the right time. Right frequency, again, is prescribed by the doctor. So we're looking at our MAR to see, is it prescribed once a day? If it's once a day, it should only appear once a day on my MAR. So does that match? And that's the right frequency. Right documentation occurs a couple of times. So for one, you're going to be documenting on your MAR after you've poured your medication, either by a dot or circle. Another one would be when you come back from giving the patient the medication that you're going to be signing off. That's your document, right documentation. And last but not least, the right reason. Am I giving the medication for the right reason? I know what furosemide is for. In this case, my patient has high blood pressure, so the furosemide will help excrete extra water to minimize the blood pressure. Those are my rights. So now let's prepare medication together. So here on my MAR, I have furosemide ordered. So let's go in order. So my first check is all the rights. So I'm going to do all the rights. Right medication. So I'm comparing furosemide to furosemide. Spelled correctly. That is the right medication I have. The right dose. So dose ordered is 20 milligrams. My label says 20 milligrams. So I'm only giving 1 tablet. That's the right dose. Right client. So I'm looking for Bob Smith. It does say Bob Smith on the label here. It's spelled correctly. And again, I will identify him when I go to the bedside. The right route. Right route is ordered as PO, which is by mouth. It's a tablet, so I know I'll be giving it by mouth. The right time. It's ordered for 8 o'clock here on the MAR. And it is 8 o'clock now, so I'm right on target for the right time. The right frequency is ordered once a day. And it comes up once on my MAR, so it is once a day. That's right. It is in the morning, which is 8 o'clock. The right documentation I will do once I do my 2nd check. I'll indicate that I've done that I've poured my medication. And again, I know the right reason, which I've indicated to you before, which is to lower the blood pressure. So that's my first check. I'm going to now open my medication. I'm giving 1 tablet because it's 20 milligrams. Here's my 1 tablet. Before I put it away, I'm going to pour it in here. Now is my 2nd check to make sure I did pour the right medication. It is furosemide. It's spelled correctly. It's 20 milligrams to 20 milligrams. So I should only have 1 tablet, which I do. So that's my 2nd check. It is for the right patient. It is for the right time, 8 o'clock. It is oral, and it is once a day. So I'm going to indicate with a dot here that I've poured it. That's my 2nd check. Now I'm getting ready to go to the bedside. So I have a tray here. I got water for my patient. I got my medication. It's very important for me to take my MAR with me because that's how I'll identify my patient. Okay, let's go. So I've washed my hands already. I'm going to come to the bedside here. Hello, this is Simrit. I'm your nurse again. I have your medication here. Can you please tell me your name and your birth date, please?
My name is Bob Smith. My birthday is May 1st, 1935.
Okay, thank you. So that matches. I know it is the right patient. So Bob, here's your water, and I have here furosemide for you. This is to decrease your blood pressure. There you go. So I'm going to make sure that Bob takes the medication. He does swallow his medication. Before I leave the bedside, I want to make sure the side rails are up, the call bell is in place, the bed is in low position. He is safe. I'm going to come back to my med station here. And I'm going to now finish up my right documentation by signing off that I have given the medication.